This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch every Sunday right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, and we are certainly glad
we are live. We are live
yes.
This week, and we have a lot of thanking to do to the station and to our good friend Tom McDonald for helping us.
Tom kind of figured this whole thing out, and it really was a mystery, and we hopefully have solved it. But we are here and ready to talk to you.
We sure are, John, and I'm glad to be back. So, folks, if our good friends are listening, please call in and hit us with some questions today.
855-839-1210 is the number here in the studio, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical Associates and how they can potentially help you and your family improve your overall quality of life. And we do that how, Dr. Molly?
Well, we do that with our overview, John. You know, it's an amazing thing. We talk about this all the time when we are live because it's important. What happens is we are a group of like-minded healthcare providers, and we can do anything that your old GP can do. In other words, we're working out of my primary care facility. But the little difference is that if you need medication or whatever, of course we can prescribe it. If you need laboratory work, we can do that and send it out to the laboratory. In fact, we have one of the labs right in our facility. That's how convenient we are. We can also do radiology, whatever you need that you would normally get from your primary care physician. You need a renewal on your prescriptions and your own doctor's out of town, we'll give you the renewal. Dr. Kasica, my medical director, is a wonderful gal. But what separates us from the rest of the crowd is that we all feel that we know that God's ingredients, natural products, natural substances, vitamins, minerals, amino acids, and other things, enzymes, can be really helpful to help a patient reduce their need for medication or pharmaceuticals, at least reduce the pharmaceuticals, and maybe in some cases get you off the pharmaceuticals.
So the goal is to help you with natural products.
Right.
And to get you eventually,
hopefully,
off of some of the medications.
Right. But again, I will never tell a patient, throw your medication away, because sometimes it's impossible to take a person off all medication in a nice, safe way. But we certainly have done a magnificent job in reducing the amount of medication people need by augmenting with the natural substances. But the way we do it is the true way in order to deliver. It's the delivery system, and we use medical hydration for that, John.
And medical hydration has been proven to work?
Ooh, yes. There's so many citations for medical. I think there was over 180 citations about medical hydration. And actually, by the way, John, when you go into an emergency room, what's the first thing usually they do?
They hook you up with an IV.
That's right. So it's also a way to deliver pharmaceuticals, by the way. So don't think it's just used for nutraceuticals. It has been used for pharmaceuticals. And sometimes why? Because it bypasses the digestive tract. It can deliver the immediate response for a physician and why he's using it. And again, you want to use medical hydration judiciously and smartly and go to a place like ours.
And when it comes to the prescription meds, we know there are side effects.
Of course.
And when you hear the commercials, you get those disclaimers that are 15 to 30 seconds long.
Well, you know.
Talk about the natural products.
Sure.
Are there side effects
Sure, of course. That's why you want to go to a place that's medical hydration. One of the things I ask is, first of all, I have to make sure that your body, you'll notice everyone in our facility gets blood work, right? Because I want to see that they can actually take the dosing that we give, which is very unique in our particular space. And that's what we want. You want us to be unique in the IV treatments that we give you. And so blood is one of the ways we're able to do this. But of course, I also, in the intake form, we ask whether you have an allergy. Let's say you have an allergy to a particular fruit, and I extract the vitamin C from that fruit. Well, I'm not going to give you that vitamin C, and as God has it, I have several to choose from. So there are many ways, and of course you can have side effects, but I'm going to tell you one side effect you don't usually have. You don't have that upset in the digestive system that you have lots of times when you go to the health food store and you pick out 4 or 5 brands that to help you get through your particular challenge. And generally people then have the heartburn and this and that. We pretty much eliminate that.
How do you determine what you're going to use for what condition?
Well,
and how does that
work?
work?
Well, as you know, I have many protocols that we've developed. Listen, hydration therapy, medical hydration therapy has been around for years and years and years. But the question is, what works for a particular patient? That's going to depend on why the patient has come into our facility, what's the challenge, what kind of medical challenge they have, and what's their goal. Because we're all about improving your quality of life. That's number one in our facility, improving your quality of life. Can we cure your cancer? No, we can't cure your cancer, but we can help you live through whatever kind of situation that you're having and improve your quality of life through it.
And you've had a lot of success with that.
Absolutely. We've had patients who come in and they were told they're in stage 4, they only have 6 months. We have managed to keep them going for a year or even longer in many cases. And quality of life, that's the thing. Most of my patients talk about their quality of life. They're thinking people. John, the listeners we have on this station, they're thinking people, right?
Yes, they are.
Okay.
Yes, they are.
And they should be in joy right now. And what's happening is that they actually look and seek out utilizing medical hydration to improve their quality of life.
How many treatments can you expect? Let's say you're starting out.
Right.
How many treatments can you expect to start with?
Well, here's the deal. One thing I tell everybody, one treatment is like a little drop of water in the ocean. It takes time. So usually between 5 and 10 treatments, if you come in early enough with your challenge, then we start to see movement in that regard. Now, if you come in stage 4 cancer and you're coming for a cancer supportive treatment, you know you're going to be with us a long time. And if you have metabolic issues, for example, there are people who refuse to change their diet and have cholesterol issues, right?
Yes.
Yeah, they'll do a little bit here and there. Well, guess what? They're going to need more than 5 to 10 treatments. You know that. So the question becomes, what part of this in lifestyle, et cetera, are you going to do to help us move you through the continuum?
Do you find that patients have to make adjustments in their lifestyle?
Of course, and they do. For the most part, once people come in and understand, and look, we're not the food police. I said this from 28 years ago, and I'm saying it today. We're not the food police. But, of course, we do want to help you maintain proper values for homeostasis. You know, I believe it's Goldilocks all the way, just right. And that includes the hydration therapy. In other words, one person's therapeutic level is not your therapeutic level. And that's a very difficult concept to sell because people go to these spas and everything, and you pick out your treatment. Hey, I have a hangover. I need the hangover remedy. Oh, guess what? I had a headache. Give me the headache remedy. No. Because therapeutic values, it's like you're taking a pharmaceutical. Usually, your physician writes for that once a day, twice a day. Do you think he writes the same for everybody?
No.
No, there are protocols that say use this drug twice a day. So if he's a non-thinking guy, which most of them are not, he's going to say you need that particular drug 3 times a day based on the history and based on certain elements in your history and physical. And we do the same.
You said you're not the food police.
No.
I did eat a piece of ice cream
Come
the
on.
other day.
I know, because we had, wait a minute, we had it in the facility,
That's
right?
That's right.
So there you go, guys,
okay.
right? We had it in the facility.
You eating that? Yeah.
Okay. And that's the point. The point is we want to improve people's quality of life. And for some people, it's like having a slice of birthday cake for their grandkid. And guess what? I'm all for that.
Yes.
Just come in the next day and we'll help chelate out some of those bad sugars.
We are coming up on our first break of the morning. Our show is called Health Watch, and it is here every Sunday from 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. And we always tell you at this point, if you want to call in, be sure to call in early so we can get to your call and Dr. Molly can take some time and try to help you out with your problem. 855-839-1210. That's the number. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. Dr. Molly and I are coming back with more of today's Health Watch after these words. Right here on Health Watch. Operators are standing by right now at Innovative Medical Associates. And what you want to do is contact them, and you can set up your initial consultation with Dr. Molly, and it is complimentary, so it doesn't cost you anything, and you're going to learn a lot. Believe me when I tell you, you will learn a lot. 856-489-0505. 856-489-0505. That's the number. And like I said, you can call now. You can call after 9 o'clock. You can call today anytime. You can even call during the Eagles game because they're not watching it. They're answering your calls. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones and talk to Joseph in Boston. Hi, Joseph.
Hi, Joseph.
Hello, Dr. Molly. You're going to kill me. I sent my information to.
I did. I'm not going to kill you. I got the information and I've been reviewing it, my friends.
Oh, thank you. You're such a sweet. I hope I can get down there to see you because maybe someone could help me because I don't want radiation in me.
I saw it. And you sound. And the other thing, though, Joseph, I wanted to ask you. It seemed like you're in good health otherwise, meaning that this particular thing came out of the blue for you, correct?
Well, I have what do they? Oh, I can hear myself in the back. I have AV. What's it called? Atrial fibrillation.
Okay, yeah. Overall, though, that's probably an age-related thing. Did you have that as a younger guy, too, as well?
I did, and I didn't. I get started a few years ago.
Okay.
I'm glad you're live. You should be live every day.
No, we're trying that. We're trying. We have to really thank our engineer who helped us out here.
Let him know the caller. I can hear my voice in my ear when I talk to you, so that won't happen again. I think I got a little problem there.
Maybe you want to turn your radio down?
No, Joseph? It is off. I'm hearing it in the phone.
Okay. All right.
But I'm glad you got it. But Fran is so nice. Here, I wanted to leave a message, and I called, and she answered the phone. It was after hours. She said, no, I'm a night person. I said, I hope we're not bothering you. But that's the story, Dr. Molly. I have reflex, and if I could ever get there, I would. I know the treatments would help.
Well, I'm trying to review this and see if we can put you on something where you are, okay? But give me a little time because I've been swamped this past week. Yeah. But I did get the paperwork and I started it. And I appreciate you sending it. God bless you.
If I ever come down, I'm going to stop in and visit you.
I want you to.
Because I don't want radiation. I know a friend that had it, and he's got problems now same with prostate. That's all they do up here. They don't do support like you talk about.
Well, God bless you. You hear me, Joseph? And please, when give me a couple more days, and I'll give you a buzz and tell you what you might be able to do at home. Okay?
Okay, Joseph.
God bless.
God bless.
Thanks for the call. 855-839-1210. That's the number here in the studio. Another difficult case. Sounds like the
Well, it's a shame. He's a FAR. It's very hard to treat over the phone.
Yes.
And Dr. Kasky and I, we say we put our worry beads on when people, send us things and they're not technically our patients and they just need a little advice. We try to do the best we can. Anyway, today, John.
Yes, we're going to talk about your old friend. You cut your teeth on this.
This is right.
Chelation therapy.
Right. And why am I interested in chelation therapy? Well, first of all, John's right. We cut our teeth on that. If you remember my very first medical director, he would say to you, claw of the crab.
That's right. And I didn't understand that.
But I did. He was the best, okay? He actually was an anesthesiologist like Dr. Kasky is, which is wonderful, I have to tell you, because they're excellent at understanding how to put together the IVs and why not to worry when things are done properly. Chelation therapy harnesses and enhances heavy metal detoxification. Do you hear how I said that? You notice I didn't say heavy metal poisoning, right?
Yes.
Detoxification. Because why do people wait till they have their heavy metals in their blood to the point of being, quote unquote, in the danger zone? Why wouldn't you want to come in the minute you found them? And that's what happened this week. A potential patient called the answering service, called actually Fran. She picked up the phone and he said, I just got back my analysis and it shows I have aluminum in my blood. Okay, he's what made me think about chelation the whole week, because you want to do it before you are in the red zone, even if you have a trace, because heavy metals, toxic metals, arsenic, cadmium, lead, mercury, others are ubiquitous. By ubiquitous, I mean they're all around. They're all around us, and they're always present. So, and they have no beneficial role in human homeostasis. So why do we want them in our blood? We don't. Get them out. Even if you have a trace, get it out. And chelation is the way to do this. And would you believe, John, recently, and I haven't looked back on chelation in a long time because, again, we cut our teeth on it 28 years ago. There's over 100 and maybe 30 citations about chelation in use today with practitioners who have clinics like we do, medical hydration clinics. You don't want to do chelation at the spa because there are many things to think about with chelation. And it's not just the EDTA. Do you remember that when I would talk about EDTA? EDTA is a man-made amino acid that can bind with certain metals and excrete them through your kidneys. But of course, you want to make sure that your kidney function is good, and there are several things. The other thing is, just remember, there are other supplements that we use in chelation because they are chelators themselves. You've heard me speak about that in the past.
Yes.
So one of the things we use is taurine. We use a very good taurine, actually, right? That helps. It really decreases oxidative stress markers. Alpha lipoic acid. You've heard me speak about that. So we're not just throwing up a bag of EDTA. We're actually adding some things to this to help a patient utilize chelation in a little alternative way.
Let me ask you a question.
Sure.
You mentioned all of these toxicities.
Yes.
Aluminum, mercury,
sure.
whatever. How do people get this?
Well, there it is. It's ubiquitous. It's everywhere. It can be in our vaccines. It can be in things we're eating. It's in fish that we get, that we think we're doing so well and eating good. It's in things that are GMO'd. It's everywhere, John. It's just everywhere. And one of the reasons why I think about it in that manner ubiquitously is that environmental issues, and we're seeing more and more of those issues, and chelation has to be a part of the environmental structure when we're protocol when we're talking about removing the environmental toxicities.
So this sounds like something that's really difficult to deal with.
Well, it can be because people don't even know they have it. I've had patients come in and they show me their blood results. And here's the problem. The way that traditional laboratories test for this, they make the cutoff for toxicity, meaning that you have heavy metal poisoning. I'm talking about even traces of heavy metal. Why do we want traces of metal in our body?
Yeah.
And they're everywhere. If you think about it, it's everywhere. It's in the air. Cigarette smoke has things in it, right? You go outside, somebody's smoking their new cigars. Guess what? It has some carcinogens. You start looking around, and what the problem is, we want to make sure that we don't want to just redistribute the metals. We want to get rid of them, even at a trace element.
Well, it's so complicated, though.
Nah, it's not so complicated.
It sounds like it's everywhere.
It is everywhere. It is everywhere, and you don't want it because the more we have, why do you want to wait till the lever becomes toxic? What you want to do is get after it before it becomes that high. So even if you have a situation where it comes back that it's showing in your blood, get in and let's get chelated, because you probably will do well in 5 to 10 treatments.
So the fellow with aluminum.
Yeah, who started this in my mind, I'm sure he's not in the toxic range. And what they consider, the laboratory considers that you have aluminum poisoning. That's my point. It's like arsenic. Where do you get arsenic? Unless your wife or husband's poisoning you.
Yes.
Okay? Where are you getting it? It's just out there. But get it out of your body. That's the important thing. That's what chelation can do.
We are at the halfway point of the show already. Yeah, you know what I say at this point. Time flies when you're having fun. It is Health Watch every Sunday, 8 till 9. You're in Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. We are both returning with more of today's Health Watch after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch. Operator standing by right now at Innovative Medical Associates. And the number, 856-489-0505. When you call, all you have to do is set up that initial consultation with Dr. Molly. You will learn a lot about what she can do for you, how she can potentially help you, and it really is a very, very educational process. 856-489-0505. That's the number, 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. Our program is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, and the number 855-839-1210. We were talking about chelation, Dr. Molly.
Right.
I have a question, though. You were saying something about repurposing the medication. Is that
repurposing? Yeah, because you repurposing EDTA. EDTA has been around since the 50s. It was used actually right here at Excise Battery to remove lead, but lead at very high levels because guys were working with the batteries, etc. So they were really exposed. So we have used it to repurpose some things, but you got to use the right chelator. EDTA is one chelator. There are many others. In fact, the natural ones that I mentioned before we went to break. So you want to use chelation therapy. And back in the day, John, and even today, we use it to help patients with cardiac issues. For example, we have used it for people who've had buildup of calcium in the plaquing of the arteries, and very successfully. Now, I'm not saying don't go in, don't get a stent. I'm not saying that. I'm saying, though, we have used the EDTA to pull out the calcium that contributes to the plaquing, and we have helped people. Maybe they reduce their need for more stenting, I can tell you that, and that is a big deal. So one of the things that we find is, interestingly enough, when we test for heavy metals, we see trace amounts of these heavy metals, or things like aluminum, lead, this kind of thing, in patients who've had these cardiac issues. So again, using EDTA, but it's not the only chelator. You've got to know which chelators work for which problems. So this is not something you throw together. The 20-year-old recipe works for everybody. No, you want to make it individualized for a particular patient. And one of the things I would say, people are always worried about their amalgams, their mercury fillings, vaccines, this farm-raised fish that has problems, foods that aren't organic. All of those things contribute to trace metals in your body. Again, I call them ubiquitous because they're everywhere, right? Don't keep them around. What are symptoms, though, of having some of these? Well, guess what? People who have chronic fatigue may have some trace metals that are causing their problem. So we probably should look at trace metals on every patient, and it's something we do run on our patients.
Can I ask you a question?
Sure.
Actually, this is not a question. This is more of a testimonial. When you were starting out,
yes,
I remember several patients, and one in particular, could not walk.
That's right.
I mean, from your door to the parking lot was about 50 feet.
Right.
He had to be wheeled up to the door.
Right.
And within, 20, 30 treatments, he was walking.
Exactly.
So that goes to show you that
we were doing this way back and still are. I mean, in terms of using it for the cardiac, and again, that's repurposed. It's not a thing where it's agreed upon by traditional medicine that you should use chelation. And I'm not telling people don't get stented. I'm not saying that. I'm saying God bless stents, but the bottom line is how many stents do you want? That's the point, right?
That's right.
And so listen, another reason why we're using chelation. How about radiation and chemotherapeutic treatments? Don't you think there's an element of metals in that? Yes. Absolutely, and free radicals. So we want to help people with this because some of them suffer from this. So when you're done your treatment protocols, that's why we call it cancer supportive therapy. We may do a shortened course of chelation as well as nutritional medicine. So it's the balance, John. And one of the things, so back to what I'm saying, people with brain fog, many times when we run their blood work, we see traces of metals. So you don't have to be in the poison level, so to speak, to have trouble. You may have joint and muscle pain. You may even have depression and anxiety. And actually, I saw that this week in younger people, which is amazing. Younger people have it. You wonder why. Well, I think it's has to do with the junk food they eat. There must be crap in that's unbelievable. So autoimmune diseases. Now, I'm not saying it's the only thing, but there are benefits from utilizing chelation therapy. So, there's research going on, but as I said before, there's over 130 citations that show this can improve these things. They can fight the cognitive disorder. It's one of the things. It's a mainstream in our neurological program. We use chelation as a form to successfully treat Alzheimer's and there's a tie between this and metals. It's amazing. People who have been just recently diagnosed with Parkinson's, we look at the proteins, we look at the Alzheimer's proteins, but we find many times they have traces of other minerals, other metals in the blood. So we're looking at this. And again, if this lowers, if chelation as a mainstay lowers inflammation, and we agree that inflammation is the root of most diseases, and that we can say, including arthritic diseases, then wouldn't it be something we should use?
I know everybody's different.
Oh, yeah.
But if somebody has this toxicity,
sure,
how many treatments would it take to maybe make a dent in this thing?
Well, I tell you, it depends. And it depends on the chelator we're using, and it depends on the co-chelators we're using, as I spoke about, glutathione, etc. There are certain chelators that have been shown to successfully lower these toxicities in as little as 10 treatments. But we need to know what tissues are involved, and that's the bottom line. So here we go. EDTA alone fights the free radical damage, and that free radical damage, I told you before, contributes to inflammation. So here we go. If we can successfully lower this in 5 to 10 treatments, then generally people are in good shape, so they come in early. But if you come in and you are in the poison range, you're going to need 30 to 40 treatments because, again, we're looking to excrete this stuff through your kidneys, so I have to maintain your kidney health. And believe me, we're very fussy about it, and we do that. That's why before we'll start chelation, we're going to look and see how your kidney function is doing, right? But I want people to realize it's not just for cardiac anymore. It really does lower pain and swelling. It can help with cognitive disorders. And there's even data that certain alternative pediatricians are using this within the spectrum of autism for young children.
So it really has a variety of...
That's exactly right.
Conditions that it helps.
Exactly right. And we have to get off of the old-time thinking that it was just used for cardiac, because indeed it isn't. At least in our facility, it isn't.
Although when you used it in the beginning, boy, there were a lot of people. I remember that your original medical director said he prevented some bypasses.
Absolutely, he did.
So
he did. He did.
Really did work.
He did. And I would say thank God, because now, of course, bypass is a pretty simple, quote unquote, not really, but it's more simplistic surgery. But I would say that what we have to realize is that there are many ways to help patients with various conditions by utilizing the laboratory and saying, look, this patient, whether he has a trace, a minimal amount, or whatever, it could be contributing to the reason why they came in to see me in the first place. And that's why chelation, the EDTA, things like the chelators are still a part of what we do. Even though I don't talk about it on an ongoing basis, it isn't like we threw it out and never go back to it. We actually use it quite a bit. Most people don't know it's happening.
Yes. And I know one particular patient this week, she was telling me, I'm getting chelation. Okay. I understood what that meant.
Yes.
But,
yes. Well, they think everything is chelation, too. I have a group of people who said, we're getting chelation. And in many ways it's true, because there are other chelators than the EDTA. But I don't want people to think we threw that out with the baby with the bathwater, because we did not.
We are coming up on our final break of the morning, which means that you still have time to jump in here with a question or a medical challenge for Dr. Molly. 855-839-1210. That's our number here in the studio, 855-839-1210. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We're coming back with more of today's Health Watch after these words. We are back here on Health Watch, and operators standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock, which means they're working all day. So if they're working, you can call 856-489-0505. That's the number, 856-489-0505. And like I've told you before, when you call, all you have to do is set up the initial consultation to visit with Dr. Molly, and that is complimentary, and you will really learn a lot about what she can do and how she can potentially help you with the problems that you may have. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show or you just want to hear it again, our Health Watch replay this afternoon from 4 until 5 right here on Talk Radio 1210 WPHT. Couple minutes left of our show, which means you still have time to jump in here with a question. 855-839-1210 is our number. Want to talk about some patients, Dr. Molly?
Sure.
And I know this patient, and she is really very nice.
She's great.
And really, you helped her out a lot this week.
I think I did. Well, I speak about Joan in a very loving way, because she is one of the nicest people we've ever treated. And I would tell you that Joan travels a great deal to come down to see us. She's in North Jersey, closer to New York than us, and she comes down once a week or twice a week in the beginning because she was going through some cancer treatments, and including the last round that she did with radiation. So she's a prime candidate for chelation therapy. One of the things she said when she came in is, "Oh, Dr. Molly, this was such a horrible week for me. I have nausea. I can't get rid of it. I just feel horrible, fatigued." Everything that we talked about earlier in the segment. So I said, "Joan, sit down. I'm gonna mix you up a recipe today that's going to help you with the nausea." Anyway, I went in, spoke to the nurse, got the order, we're good to go, and we mixed up something. And at the end of the drip, she said, "I'm feeling a little better." But what really tickled me was she called the next day and said, "Dr. Molly, whatever you put in that recipe helped me so much. You should bottle it and I'll sell it." And she said, "And thank the girls for taking such great care of me." I said, "Just the girls?" She said, "Oh, no, thanks, Jim, too." I said, "Okay." So the point I'm making is that, again, the recipes we use, John, are specific for patients and patients' concerns. You can't have one size fits all, which means the difference between going to a spa and going to a medical hydration.
And how did the chelation, what did it do?
Well,
help her?
In this case, what we were doing was I was giving her some natural products that might help her nausea, things like ginger. But using ginger in terms of IV there is a specific constituent in the ginger that works. But guess what else it works on? It works on your cancer too. So look, I'm not going to give away all my recipes.
Of course not.
Yeah, but I am going to say that in this case we really helped her.
And what are you going to do to continue?
Well, I want to hear back from her this week. Is she feeling better? Does she still have the nausea? Because if she does, then we continue on the same protocol. But if she doesn't, it's time to bring in some other things, again, to aid her through the cancer journey a little heavier. So sometimes you just got to step back some things and bring in others. It's the Goldilocks theory, just right. So you can't say you do the same treatment protocol every week. You just don't.
I know she was feeling good because she came over to me and told me a joke.
Yeah, she's a great lady. She's a great lady. And this week I had several patients that went home to Ohio. One of them was the one who was depressed and had some neuro issues. And interestingly enough, they work in woodworking, so they have a lot of environmental issues that are contributing to the symptomatology when they come. They were feeling really good. They got home. Everything was great. I had a follow-up with another patient who left to go to Indiana, and she was there for 5 days with me this week, and we actually did a Skype call to a large institution who was close to my heart, I can't say which one, that does a lot of work with lung disease, that kind of thing. We actually had a Skype call in our facility to the infectious disease doc, along with myself and my doc and the patient and her husband, and we're going to follow up with them on an ongoing basis. So these are the things we do for our patients.
Did you do something with regenerative medicine?
Yes, that was the last thing I want to talk about. Yes, we did. Dr. Casca inserted some exomes and, again, the PRP, but we have a combination protocol. We use hydration therapy as well prior to the injection that actually tunes up the body to accept the regenerative injection very quickly. This patient, he's up there in age, he goes, "Oh my God, thank you." And interestingly enough, he came to us because he had it done in a very quote unquote well-known place, and he ended up getting an infection in the knee he had done earlier, the other side, which we're not doing. We're not touching that knee. We went to the other one, but because he's using it so much more. But he called me and told me, wow, his daughter called and said, "Wow, he's doing great today. Thank you, Dr. Molly and Dr. Pat."
Are you doing a number of regenerative medicine cases?
We're doing more, I can tell you that. And again, we use a PRP, which is platelet-rich plasma, which has been accepted at this point, but we use a particular protocol where we're able to get a larger yield of the substances that work. Okay, the cofactors that work in the knees or in the shoulders and that kind. By the way, Dr. Kask is excellent with the needle. I would tell you that most patients say, "Wow, I can't believe she got into that spot," and she did. God bless her.
Yeah,
okay. And listen, this is a woman who came to me as a patient, right, and got so excited about her recovery from MS that, and again, she has MS. She follows this, but she really listened to what we said, and as a result, she became our medical director.
We've told this before, but she was so bad at one point, she was thinking of leaving the business and starting another business.
She wanted to leave
really,
medicine.
Yes.
Medicine, which I said, "Are you kidding me? With the hands you have, you're going to leave medicine? I guarantee you, sit here with us, we'll get you back." And she said, "I'll tell you, Molly, you did."
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by at Innovative Medical Associates, and they will be there well after we leave you this morning at 9 o'clock. 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, you get the Health Watch replay this afternoon from 4 until 5. For everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, and Jim, and of course there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. Talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.